Hello, everyone. I wanted to share my experiences and takeaways from my visit to Salt Lake City for the KLAS Arch Collaborative Learning Summit that took place on July 27th. I also wanted to connect the dots from last year's surveys that was launched back in March and April, and what's next and what I need for all of us to do. So, without further ado, we'll jump into my experiences and takeaways. But first, I would like to talk a little bit about what KLAS is. So KLAS is a third-party research company that partners with communities of healthcare organizations across the world, focusing on maximizing the ROI or return on investment of our organizational EMR investment, not just Epic, but all EMRs. KLAS has developed a standardized EMR experience survey to help organizations know where they are with regards to adoption, usage, and the overall experience of those who use it. KLAS also has a robust repository of best practices from organizations all over the world, and its culminating event is the conference, as I mentioned, the Learning Summit by the KLAS Arch Collaborative that took place in Salt Lake City the end of July of this year. So UVA started their partnership with KLAS back in 2018, and we've launched 4 surveys to date, with our 5th taking place in October of this year. So partnering with KLAS, it gives us really a consistent way to hear from our frontline team members with regards to their use of the system. It helps us provide benchmarking or scores that we can leverage against ourselves in past surveys, as well as the performance of peer organizations. It gives us a lot of data to help with the prioritization of training, workflows, access, communication, and governance improvements, which we have been doing over the last year. And it also provides a free text comment section that really helps us see what those numbers don't always do a good job at explaining. And we received quite a bit of feedback from our frontline team members last year. The survey this year is a little bit different, as it's starting to incorporate the AI questions, as most EHR systems now have AI functionality embedded in their systems, so they wanted to account for that. Our September campaign will be really focused on showing all the work that we've done over the last year as a result of the last survey, and leading up to the launch of our survey on October 1st. And the training teams can really do a great job at helping the clinicians see the survey as a feedback loop, and not just another survey. So since the launch of the last survey, we've collected thousands of responses from our frontline team members. We reviewed the results, and much of what we have been doing over the last year has been based on that feedback. We received an overwhelming response asking for more effective training, more training offerings, specialized training, and ultimately they want more of us and not just classroom time. Over the last year, we've implemented secure chat, happy together, e-consents. We started our monthly rounding parties. We really leaned into the design teams, and we're now in the process of provisioning phones for nurses. And all of this was a result of the prioritization and responses that we received from last year's survey. Now we're in the closing of that loop with the organization on our efforts and leaning into where we're going in the near future. So just for awareness, we do have an EMR experience project team that consists of our CIMO, our CINO, and ACIMOs, so communications, the KLAS Arch Collaborative Customer Success Manager, Kate, and myself, and we meet periodically to review the results and plan. So I heard a bunch of things over that week that I was at Salt Lake City. I had attended several sessions daily, and want to share some of those takeaways from other healthcare organizations, but perhaps at a high level. So I heard the following. In order to launch a successful AI implementation, governance is required, followed by AI literacy training, and Beacon Health had a robust AI training program, and attendees received digital badges to display in their emails and showcase their efforts in understanding and use of the tool. I heard that to really maximize the use of our EMR systems, Having a central pipeline or funnel in a prioritization process and ensuring standardization is key, similar to what we will be doing with regards to the refuel. I heard that our content changes, not just ours here at UVA, but in our worlds across the country. Our content changes too often to have static learning. As you know, anything we create needs to be maintained, and we have prioritized that through our less is more, WCAG, and maintenance months. I heard that informatics is a bridge for operations and IT and training. The informatics role at UVA will continue to grow in value and importance. They're already doing amazing work, but it shouldn't be an afterthought. We in the training world should know how it feels to be an afterthought. I heard that change management and change leadership consist of concepts and principles must not be only leveraged but employed by the use of specific training tracks for roles that are affected. We'll be taking this approach with our new design to ensure that all team members are familiar and proficient with the new expectations and competencies for the updated roles. And I also heard WIIFM, which stands for What is in it for me? And it's important to start with the why, to keep those whys at the forefront of the changes that we're making. This is why I took so long, or it took as long as I did leading up to the changes that we were making at the retreat. So sorry I ate into your break times in the breakout sessions. While we're ensured to cover what's in it for you, it's also important to look at what's in it for our customers we serve, as that's why we're here. So one of the first themes was AI readiness is a training issue. And at Beacon Health, they had an awesome presentation related to their AI literacy program. And we're working on the same thing here. And Aaron is leading this effort for us and has been working closely with our AI governance steering committee and stealing some of their stuff. In our world of education, as you know, stealing is not a crime, it is best practice. The second theme was informatics and optimization requires a visible pipeline. And at the Children's Hospital in Philadelphia, as they refer to themselves as CHOP, they had amazing results leveraging their nurses on their units and empowering them to drive some of their improvement initiatives. They made themselves available synchronous and asynchronously for selected nurses on their units to drive improvements. And with this strategy, it was led by the clinicians, so there was more ownership and resources available from operations. They provided Kaizen events and standing office hours to make themselves available and share tools and best practices, and had a singular method in which the organization optimizations were taken, reviewed, and worked. So by leveraging the nursing teams, they were able to make a lot of changes very quickly without overburdening the informatics teams. Another theme that I heard was about change management, and it must be role specific and local. So with change management, there needs to be training roles specific to those undergoing the change. At Memorial Herman's presentation, as well as the keynote from Dr. Rachel McIntyre, she emphasizes the needs to start with the WIIFM, or what's in it for me, in order to decrease the resistance of the change. At Memorial Hermann, they created training tracks for each role affected by a large hospital implementation and empowered the super users to train their peers for increased buy-in and ownership. They offered ongoing change management training up to 5 hours a year, even after the implementation, to help with sustaining the changes that were made. They monitored signal data and tracked adoption and used and the overall use to ensure that each leader was trained on how to receive feedback with empathy, as everyone experiences changes differently. The fourth theme that I heard was learning is not the same as completion, and I agree 1,000%. Another way to say that is completing training is not a sign that learning took place. It's important for training to be nimble enough to offer continuous offerings and updates and ensure multiple different pathways are available for learning. And this is what we're working on towards our third phase of our redefinition of the training team at UVA, the student-centered learning phase, where we'll have different modalities to offer based on the learner's preferences. Theme number 5 was interesting. The fast implementation still needs disciplined follow through. And this was a lesson taught by Honor Health, who had to implement a whole hospital within 3 months. So their takeaway was speed can be necessary, but every shortcut needs an owner, a date, and a revision plan. So they were able to be successful with this 3-month implementation because they emphasized and anchored their actions with their mission, their vision, and values. They ensured that training was a part of the process before being provision access. They deployed at the elbow teams for quite an amount of time after leading up to the implementation, during the implementation, and after the implementation. And they did a lot of work to track the shortcuts or things that were cut out in order to meet the short deadline so that they can go back and revisit it after the launch, which is important. So what this means for the HIT training team, or for us. So AI literacy, develop a practical learning pathway tied to governance and approved use cases. Create levels of support based on how much change each audience will experience. Move beyond launching the training into monthly bundles, rounding, and follow-up support. Help define the training lens for scoring readiness, communication, and adoption risk. Leveraging the super users and power users and informatic partners as local adoption channels. And using the data that we have available, such as Signal, our ELL engagement, and other qualitative feedback as a single story. So why September needs to be a campaign month? So for the month of September, we'll be working to create awareness about the work that we've done over the last year as a result of the 2025 EMR Experience Survey, and create awareness about the new survey that's launching on October 1st. We want to leverage our USUP networks. We want to share the news and flyers while rounding, and we have a meeting circuit that we're working, and the intention behind that is to drive awareness throughout the organization at these different forums. The survey will last 6 weeks, and it will start on October 1st, and we'll be sure to share those results once those results are available. So this is just a quick glance of what it was going to look like over the month of September. We'll continue to work through what we call leadership alignment, creating our talking points and providing them to each one of the EMR experienced team members. We're working with communication with regards to our run a show and leveraging our different networks that we have to share the work that we've done as well as the survey that's coming up. We'll be rounding and at different huddles, and we have working on a flyer to share that will take us to the survey and build awareness around our campaigning. And then the last week is just, again, reinforcing the participation. We'll continue doing that through the month of October, through the completion of the survey, which will last for 6 weeks, through the middle of November. So just some key points to give some clear directions. We want to use September and October touch points to connect the survey to real improvements and future opportunities. Tell leaders and clinicians your feedback is shape the actions, and the next survey shapes what comes next. We want to ensure that these questions or concerns and different feedback that are being received from these different forums are received, reviewed, and quickly acted upon. And we want to be ready to support the targeted follow-up when these response dashboards show us different gaps. As that's the whole point of us surveying our frontline team members, so that way we can find out how we can meet them where they're at. Lastly, I will just leave you with a phrase that resonated with me, that was part of the keynote delivery of the Learning Summit at KLAS, is that technology problems are often just human problems that live in technology. So I thank you for your time and your attention, and please ask for any feedback, any questions, points of clarity that you may have after you're listening to this. Thank you.